Hi everyone, Dr. Nutt here. Today we're going to talk about another category of psychological disorders that are very common, the most common being anxiety disorders and then mood disorders. But mood disorders are when a person experiences major disruption in the area of emotion, okay? And one of the common types of mood disorders would be MDD, major depressive disorder. And this is when a person experiences sadness, hopelessness, and helplessness, and also a loss of interest in things that used to interest them no longer interest them. And usually it's really again disproportionate or does not match their circumstances. If an individual maybe looks at their life, things are going pretty well, so they can't really explain or come up with a theory about what could be potentially causing this sadness or despondency. And it lasts for more than 2 weeks. That tends to be an important criteria because if a person experiences, a down day here or there, that still does not meet the criteria for MDD. Now, another common mood disorder is that of persistent depressive disorder. And this is when someone has really long term depression or they have like a low grade depression. They tend to function, um, you know, uh, okay. But again, under the surface, their underlying emotive experience is a sadness. Okay, that persistent depressive disorder in the past was called dysthymic disorder. Okay, one of the last major depressive disorders what I'll mention to you is premenstrual dysphoric disorder, and this is when an individual, females, tend to experience, severe irritability, low or anxious mood or emotions during the premenstrual cycle. And it's typically a condition that kind of resolves itself shortly after a woman's cycle. But um, what people may not realize is occasionally, this could be so severe and disrupting to a person's life that professional consultation may be needed. Now, a couple of important facts about MDD, major depressive disorder. Typically, it affects about 1 in 5. And women or females tend to be more likely to be affected. It is a cause for disability, typically for Americans ages ranging from adolescence to middle adulthood. And it is a worldwide issue. And when an individual experiences major depressive disorder, there is an increased risk of suicide. So that is one of the major factors and concerns for major depressive disorder is the risk of suicide. Some of the potential causes of mood disorder include genetic factors. We know there's an inheritability rate of about 40 to 50%, and this is based on identical twin studies. Also, and again, this is very important information. I'm kind of highlighting the brain here on the slide, but neurotransmitters also seem to be involved in mood disorders. We know specifically with depression, neurotransmitter norepinephrine, serotonin, and dopamine, specifically a deficiency in serotonin, tend to be involved in mood disorders. And then also hormones play a significant role in mood disorders, such as the high levels of cortisol and also the HPA, the hypothalamic pituitary adrenal system, seems to be overactive in those that suffer with mood disorders. A couple of additional explanations for mood disorder include learned helplessness from a behaviorism perspective. And if you remember from the chapter on learned helplessness, hopefully you're thinking of a baby elephant tied to a stake in the ground. But learned helplessness is when people have this passive resolve. And again, they believe that their actions really have no control over their behavior. And so researchers believe this is a major contributing factor to mood disorders. And then if we look at it from a cognitive psychological perspective, the idea of the thinking patterns in clients and patients that suffer with mood disorders. There's a pattern of negative thinking, what I call ANTS. ANTS, this stands for automatic negative thoughts. And again, it's kind of like that stinking thinking, if that rings a bell. It's the idea if a person thinks, oh, I will never get better. Well, if you think that way, you will probably never get better. If a person thinks, oh, this will never end, again, that's probably what their experience will be like. Okay, so another type of mood disorder is bipolar disorder. Bipolar involves both depression and mania. Okay, if it's not full-blown mania, it could be what is called a hypomania, which is really just a person's a slightly elevated self-esteem. Okay, and there are different types of bipolar disorder. That this is maybe some new information that I want you to keep in mind. Bipolar 1 is the extremes of mania and depression. Okay, that mania is when people feel excessive excitability. They may become hyperactive or energetic, and they engage in real grandiose behavior and ideas. Whereas, so you see bipolar 1 right here. And then on the flip side, you can have bipolar 2. Bipolar 2 is more like a mild mania. This is when a person experiences mainly sadness. And then you've got the major depression right in the middle there. Okay. So hopefully this kind of gives you, a diagram to help kind of, or an illustration of how to fit these concepts in your mind. Okay. And my fear is that many people that maybe seek out professional help think they have depression when they could have bipolar 2 because they don't notice these mild manic episodes. Another category of disorders that is quite a controversial category, that's the dissociative disorders. That includes dissociative amnesia, when a person experiences a trauma and they have it because of the trauma causes the person to not be able to remember who they are or their identity. And then you can also have what is called dissociative fugue. And this is, again, when a person experiences some type of emotional trauma. It involves the loss of identity like amnesia, but they'll end up traveling to some other location. And so we really don't know how many missing persons out there could be examples of fugue. And then also the dissociative identity disorder, it is what used to or historically has been known as multiple personality disorder. And this is when a person has two or more distinct separate identities or personality states. And these different personality states that exist within the person really they can have different accents. They can have different skill sets. They can it affects their memory. They may experience blackouts. They may even have different identities that play instruments, or like I said, they have different skills and things like that. Very controversial disorder. There was much debate over whether or not to include it in the DSM-5, but it's still in there. So in my clinical experience, I've probably only seen one patient that I believed to really have the symptoms of dissociative identity disorder. The last category I will mention is known as somatic symptom disorders. Somatic symptom disorders are disorders that revolve around, preoccupation with one's body. Soma meaning body. And so somatic symptom disorders, when a person has persistent thoughts about illness, or they maybe report or complain about vague illnesses. Okay. Now, you may be familiar with illness anxiety disorder. That has historically been known as hypochondriasis. And again, the person has a preoccupation with having some serious illness or disease. And commonly it's diagnosed with obsessive compulsive disorder. And there's no physical disorder that can be found. So this concludes our discussion today, finishing up our chapter on psychological disorders. Hope you have a great day.